Okay, folks, we are live. Let's get started. We'll go ahead and get underway. We're out on YouTube now, I understand. Make sure you turn off your phones. Madam Clerk, would you please call the roll?
Bell,
Here.
Curran,
Here.
Freeling, Harrison,
Here.
Hinkleman,
Here.
Jarrett,
Here.
Martin,
Here.
Scott,
Here.
Ballraff, Werfel, Yarborough, Elliott.
Here.
Mr. Chair, you have 11 present.
Thank you. April 28th?
Well, April, I think that's,
No, that's correct.
Really? Oh, I'll be darned. Okay. Committee of the whole minutes from April 28th need to be approved.
So moved.
Support?
Second.
Moved by Scott, supported by Volrath. All in favor signify by saying aye.
Aye.
Opposed, same sign. Minutes are approved. Requisitions.
I have the requisition request or report. Does anybody have any questions about any of the requisitions on that report? No? All right, thank you.
Thank you. You want to do Guy Miller?
yeah. Members of the board, we are going to have Guy Miller present you with an update. We do have a couple of guests in the room. As soon as Guy gets done, I've got some folks that we'll bring up just for quick updates.
Guy, you want to come up to the podium?
You just got a resolution. You just got a resolution.
While Guy and Annette are having a quick conversation, I'm going to ask Paul to hop up. Everyone knows Paul Jancha from our Public Defender's Office, and Paul is going to have a really busy weekend. Paul, are you willing to brief the board?
Absolutely. Good morning, everyone. If you all recall, in the process of forming our emerging adult task force, expansion of the Public Defender's Office into juvenile representation, really elevating our service there, we saw an opportunity to strengthen the community of the Twin Cities of Benton Harbor and St. Joseph by creating an event. And so this weekend, we have a youth basketball event, 3-on-3 tournament. And we have, I believe it's about 100 kids signed up to play, middle school, high school age, 2 brackets. We've partnered with the Boys and Girls Club of Southwest Michigan. There's going to be on Saturday, starting at 9 a.m., the middle school age kids will be at the youth campus, Boys and Girls Club youth campus, for about a half day. And at the teen center, we'll have the high school age kids. And these are kids, I reached out to Michigan Lutheran, LMC, St. Joe, Benton Harbor. So we should have a good mix of teams and really a good opportunity. Sunday, Brian gave us permission to use the Shadowland Pavilion. And so on Sunday, we'll have basketball, sort of the championship games under the Shadowland Pavilion, starting at 9 a.m. We have had a huge component of this, a major component of it was to improve, work on the relationship between law enforcement and our youth and strengthen our community. And so we have partners from all of the law enforcement agencies from the Twin Cities, especially the Sheriff's Department. They're helping us with food and drinks and things on Sunday. One thing I do want to mention is we've worked with obviously county administration, building grounds, printing, parks, financial services, and especially the sheriff on this. We had a private donation. Sam Abdenauer donated, and he's indicated I can mention that, donated the floor for the basketball court, the tiled floor under the pavilion on Sunday. So we're really excited about it. It's really about honoring the community, law enforcement, and our youth.
So what Paul hasn't mentioned is you all are playing, so Sunday morning. While Annette and Guy are getting plugged in, we have one more introduction to do. And Elvin, I'm going to hand over the mic and let Elvin introduce you.
Good morning, Commissioners. I'm Elvin Gonzalez. I'm the Family Division Administrator with responsibility over the juvenile justice services here in Berrien County. And for about the last months, I've been wearing two hats. I'm the Family Division Administrator, and I was the interim Berrien County Juvenile Center Director. Two full-time jobs, a lot of fun, but I'm ready to pass the torch. And so I'd like to introduce to you today Mr. Gregory Skipper. He is the new Berrien County Juvenile Center Director. Very pleased to have him. My wife is even more pleased to have him because she knows that those calls that come in after hours, those conversations with chiefs of police and prosecutors will be handed off. And so I'll turn it over to Mr. Skipper and let him tell you about his background and his experience that he brings to the table. Very pleased to have him. We're going to partner well together, and so I'll turn it over to him.
Good morning. I want to thank Mr. Doucette for the invitation. I want to thank the group for having us. As Mr. Gonzalez indicated, I've kind of transitioned over from the Michigan Department of Corrections, where I spent 36 years kind of covering all the bases there. Started out as a corrections officer, got into supervision, went over to some treatment in terms of being an assistant manager in the housing unit, manager in the housing unit, an assistant deputy warden, a deputy warden, and I retired as a warden. One of the things that I want to say is that at the Juvenile Center, the team, there's nothing special about me, but I have a great team. And in conjunction with that team, we want to improve public safety by kind of reprogramming the children, getting them ready to return back to the community as productive citizens, which will make for a safer community. Thank you so much for all that you do in the community, and I look forward to working with all of you.
Thank you.
Thank you.
Okay. And Guy, are you ready?
I'm ready.
Okay.
Good morning, members of the board. Thanks for having me this morning. Again, Guy Miller with the Berrien County Health Department. I just wanted to give you guys a few updates on a couple health department related topics. COVID-19, the action level exceedance, what's going on with the Abbott formula and our WIC program, and some campaigns we've got going on. First off, talking about COVID-19, I've been getting a lot of concerns from family, friends, and a few residents just about the high number of cases that we've been seeing. I think we've had a lot of concerns from residents. Should we be doing more? Should we be doing certain maneuvers or certain things to help reduce the spread of COVID-19? I think it's important to highlight where we've been with the pandemic and where we're going. We have been in a position with the pandemic where we had a high number of COVID-19 cases and no medical interventions, no vaccinations, and a high number of people in the hospital. Our goal in the health department was to decrease that hospital rate so that people who wanted care or could receive hospital level care could access it. That was not really a problem that we had during the COVID-19 pandemic. Although the space was tight at the hospital, our hospital continued to respond to the pandemic. And over the last few weeks, relatively to where we have been, the hospital cases have been low. We've been seeing about 8 or 9 cases of COVID-19 positives in the hospital system. The hospital system is not by any means overwhelmed. I think a lot of this is the impact that the vaccines and the interventions, the pharmaceutical interventions have made to decrease the severity of the illness. COVID-19 does not have the mortality rates that we've seen. It does not have the morbidity that we've seen when the pandemic first started. Therefore, our response has been very, very mild in consideration of what other impacts have been around the nation. We've seen rates slowing in Europe. We've seen in Michigan, rates have been increasing, but those are measures of positivity. And we all know that positivity is dependent on the number of tests. Back in March of 2020, you couldn't get a test, or you'd be lucky to get a test if you were in the ICU and you had respiratory viral illness. We were that limited in testing capacity. Now you can request a testing kit from the federal government and they'll ship it to your door. So the testing landscape has changed significantly, but we do know we can look at those hospital metrics. Those are reliable metrics to say, what are we seeing with the severity of illness of COVID-19? And I'm happy to report those numbers remain low. In May, we did have 777 cases. In April, we had 417, but in January, we had about 7,500 cases. So we are seeing an increase in cases, but our hospitalizations are staying low. which is great news. Our vaccination rates remain high. The Berrien County Health Department remains dedicated to vaccinations still. We are getting quite a few people coming in for vaccinations for COVID-19. We're continuing to offer those at the Benton Harbor Health Department Tuesdays and Wednesdays, and by appointment in Niles on Thursdays. So we are still responding with COVID-19 vaccinations for our community. The other items I want to talk about is the action level exceedance that the Berrien County Health Department is supporting with the city of Benton Harbor. We are providing filters when residents are requesting them. We're making them available for any resident who would want them. They can call the health department. They can walk into the health department. We can mail them to your door. The state has been supporting us largely in those efforts to make filters widely available to residents. We know that when a filter is properly maintained and installed correctly, it's effective at removing the lead in the water. On the other end of it, replacement of lead service lines, they're over 55% of the way through, which is very good. I think they're a little bit ahead of schedule. We can anticipate that as we get 90, 95%, you're going to find that those 5% of the homes are probably going to be a little bit harder to get into. But it looks like they've been moving right along with the lead service line replacements in the city of Benton Harbor. So that's good news. We did have the, in February 17th, Abbott Labs recalled their baby formula due to possible bacterial contamination. It was a voluntary recall, and we're still seeing the impacts of that, especially with our WIC program. Our WIC program did go back to serving clients in person starting June 1st. So we are now seeing clients in person again, which is really great. It gives our dietitians a good moment to sit with the family, with the baby, do measurements, go over nutrition and diet, and assess for any problems that mom or dad might have. So we are continuing to do those in person, and we are feeling the crunch of the shortage of baby formula as well. That's been a significant impact. It just hasn't been available. And if the supplier is not creating it and we don't have infant formula available, we can't provide infant formula. And I know the stores have been struggling to find it as well. My last update is we are successfully launching the Dirt on Weed campaign for our prevention, which is really teaching people how to store marijuana correctly, make sure they keep it out of the hands of toddlers. It's an education campaign focused on high risk, so really looking at pregnant women, the effects that marijuana can have on baby. So you'll start seeing those signs pop up around the county. The last thing I just kind of wanted to mention is I'm very pleased to continue in this role. I've been learning a lot. I've been meeting with a lot of different health departments, different health officers, different members of the community to make sure that I'm doing my role as effectively as I can. So I just wanted to say thank you. You will see there's a resolution for my continued appointment, and just wanted to thank you all for this opportunity to serve. Any questions?
This is really critical. So aren't we starting the Benton Harbor Farmers Market, and then we have a grant from the state for people purchasing fresh vegetables and fruits?
Yeah, thanks for that reminder, Commissioner Harrison. The Benton Harbor Farmers Market is starting the 22nd, and it'll be open from 10 a.m. to 3 p.m. at Dwight P. Mitchell City Center Park. That farmers market is unique. It does offer a lot of food assistance programs, such as WIC. You can use your WIC benefits down there through WIC Project Fresh. There's a Senior Project Fresh program. There's the Double Up Food Bucks program, and as well as we accept food stamps or the bridge card down at the farmers market. So we did receive some supplemental funding. It was about $3,000 to help us offset the costs of what that program can reimburse for. So pretty much if you go down to the farmers market, you swipe your bridge card for $6. We give you $12 in tokens. 6 of that are directly from the bridge card. And then another 6 are supplemental in that $3,000 we received to be spent on fresh fruits and vegetables. And it's very specific. They want them locally sourced, which is why we're using a lot of our local farmers are there. We're not getting produce from Washington State or anything like that. These are local farmers who are providing their produce to our citizens. The other aspect, the United Way has contributed a significant amount of money to help this farmers market operationalize, such as purchasing tents, getting a little bit of signage, some T-shirts for the vendors and the farmers to wear and feel like they're part of the farmers market. We don't charge anything for vendors. We ask them to show up consistently. They do sign a lot of contracts to be involved in a lot of these state benefit programs for food assistance. And we as the health department do run that and make sure that we keep the books clean so that we can report it back to the state and receive funding. So essentially this $3,000 that we're receiving from the state is just being used as supplemental funds. It'll go in, it'll circulate. Anything we don't use, we'll hand back to the state. I hope that we spend all of that on paying our farmers, because we've had our residents come in and spend at least $3,000. And that's only through the Double Up Food Bucks program. Thanks for the reminder.
May I say something?
Yes.
I represent the city of Benton Harbor, and I thank you all. And I'd like, as I go, it's getting bigger. And there are people that make things like oils and scents, and they're there. And the Benton Harbor Public Library has an area. We're there every Wednesday for the children with coloring books, and we read to them and do activities. And there's a man who plays the saxophone. So it's coming to be a very nice thing, and it's a pretty spot. That's why I'm glad you all are there, because I know you used to do it at Mercy Hospital many years ago. And so thank you.
Yeah, thank you, Commissioner. We've been running the Benton Harbor Farmers Market for, it's getting close to a decade now. So it's always been a consistent ask that we've tried to get the community involved in, and we appreciate the partnership with the city as well. That's been a great one.
Any other, yes, sir?
I just have a question. Now that the COVID pandemic has kind of wound down, what is the health department doing on an informational basis and preparing for the next pandemic of monkeypox? Because people are starting to wonder about that, and they don't know. There's so much disinformation. Do you guys in your staff have anything that you're compiling to put together to inform the people so that they can make decisions?
Yeah, so in terms of monkeypox, Commissioner Scott, that's something we measure. There's always something kind of circulating out there before it gets to the pandemic level. We're always keeping an eye on it. So we do have a division of communicable disease, which is measuring everything from STDs to mumps, vaccine preventable diseases. And we have seen things like that in tuberculosis. We've seen cases of tuberculosis in the community, which we're constantly working on to treat. And we partner with Lakeland for the treatment of unique infectious diseases. So in terms of preparing for the next pandemic, that is something we are required by the state to do. That's that emergency preparedness coordinator position is really responsible for creating and generating those plans. Obviously, the next pandemic, whatever it may be, is going to be unique. We won't be fully prepared for it, but it is about making sure that we're having those consistent conversations around the table of what happens if monkeypox does turn pandemic, what happens if we've got a new emerging infectious disease, and how do we respond to that. It's also about keeping those lines of communication open and making sure that when something happens, we know who to contact at the laboratory, in the hospital, or at the state lab to make sure that we can get additional testing through state or CDC sources, because they've got much more better laboratories than we do in testing availability. So I think if you look into the monkeypox case, you'll see that it did have to go to CDC for additional testing and screening to be identified as that specific type of virus.
All right, and I know it has anything to do with you, but I'll get a hold of the MSU epidemic or the entomologist due to the fact that I'm still waiting on the murder hornets to show up.
Jim?
About the baby formula.
Yes, sir.
I'm not sure if you're aware yet that Myers and Stevensville and Benton Harbor received tremendous amounts of pallets of baby food.
I'm not, but I
Yeah,
can
they're
definitely make
stocking
sure.
their shelves, and they had it lined up all the way down the aisles.
That's excellent to hear.
So they are delivering finally again.
Thank you.
Anyone else? All right, thanks, Guy. Brian,
Thank you.
did you have anything before we go to public comments?
Yeah, members of the board, today's admin committee meeting We will have a team from Whiteman and Associates meeting with the admin committee, having a discussion about a proposal for juvenile center design services. My intent is if admin says, yes, this is the firm that they recommend, I would then be bringing them forward to a committee of the whole for the full board to receive an update and presentation. If admin feels they need to see a couple other proposals, then we would take the same approach, whittle it down, and then bring forward the recommended firm for committee of the whole. The reason I want the board aware of this is that this is going to be a lengthy project, and it's one that it has a very high dollar associated with it. So we're starting with admin today, and then based on how today's meeting goes, we'll be bringing it forward to the committee of the whole for a future discussion. Mr. Chair, those are my comments.
All right, very good. We're at the point to receive public comments. If anyone has anything, 2 minutes or less, name and where you're from. So,
Tony Benhart, so I had the unpleasant 17 minutes the other day trying to get a hold of a department head by phone. By the time I got done, I had talked to 7 different people that I never even wanted to talk to. There's no way to get an operator. There's no operator on board down at the courthouse evidently anymore. And I thought this county was supposed to be going forward. I think a tin can and string stretched across the county would work better than this phone system down in the courthouse. When you have to make a call and you're on a call for 17 minutes and you get 4 people that you didn't even want to talk to, something's wrong. And if that's the kind of stuff we've got going on, and the other thing is if there's nobody down there answering the phones, what's going to happen with the money that was put out for that person for their pay? I have not seen one amended budget passed around yet. We've got, what, 90 some openings in the county, and there's been no amended budget. What's happened to all that money? Where's it going? What's it being used for? You just basically acknowledge the fact that you have a design firm for a new juvenile center. Did that go out for RSV quotes or anything? Or was that just a, oh, we're going to choose that person? Things are not going right, I don't think. Maybe it's time the governor and the state get involved in what's going on down here.
thank you. Anyone else? Other business? Anyone have any? Yes, sir.
Mr. Chairman, I just wanted to bring to the board's attention a handout from this gentleman here. He's been to us before. I'm not sure if he's going to address anything in the public comment portion at the regular meeting. So he asked that I make all the board members aware of the correspondence that he has given to us.
Yes, I would like to make that time.
You're going to speak at the 10:30? Okay, then he will speak at the 10:30 addressing this and his issue.
Okay,
Thank you.
thank you. Anyone have anything else? All right, and we stand adjourned to 10:30.